While medical science has advanced significantly, some older doctors may still hold on to certain practices or beliefs that newer generations of doctors have moved away from due to updated scientific evidence. Here are 6 such practices. Routine use of antibiotics. If your doctor has been still big on antibiotics, it may be time to look elsewhere. The routine use of antibiotics for viral infections, such as the common cold or flu, is a practice that persists among some older doctors despite modern evidence-based guidelines advising against it. Antibiotics are ineffective against viruses, and their misuse contributes significantly to the growing problem of antimicrobial resistance. According to the CDC, at least 28% of antibiotics prescribed in outpatient settings in the United States are unnecessary, highlighting a critical area for improvement in prescribing practices. Overuse of imaging tests. If your doctor just loves ordering imaging tests no matter what, it's a sign they're probably stuck in the past. Overusing imaging tests like X-rays and CT scans is a concern in modern healthcare, especially when older physicians rely on them extensively. This practice can lead to unnecessary radiation exposure, increasing the risk of cancer and other health issues over time, as radiation exposure is cumulative. Newer guidelines advocate for a more conservative approach, recommending non-radiative alternatives like MRI or ultrasound where possible, and emphasizing the need for clinical guidelines to ensure appropriate use. Aggressive treatment of mild hypertension. You know you have high blood pressure. Okay, your numbers say so, but are you sure you truly need medication? And even so, aggressive medication? Probably not. Previously, even mild cases of high blood pressure were aggressively treated with medication. Current guidelines recommend lifestyle changes as the first line of treatment for mild hypertension. These changes include dietary adjustments, such as the DASH diet, sodium reduction, increased physical activity, and weight management, which have been shown to effectively lower blood pressure. If lifestyle modifications do not achieve desired blood pressure control within 3 to 6 months, medication may be introduced. Bed rest for back pain. Okay, you've tried lifting something heavy and it didn't turn out well for you. Ouch! Back pain is real and nasty, but if your doctor has recommended extended bed rest for back pain, you need to consult with someone else. Prolonged inactivity can lead to muscle atrophy and stiffness, ultimately delaying recovery and potentially exacerbating pain. Current guidelines advocate for maintaining activity levels and using physical therapy, which have been shown to improve outcomes and speed up recovery. Hormone replacement therapy, HRT, for all postmenopausal women. Okay, so you visited your doctor yesterday for all those debilitating postmenopausal symptoms, and guess what? The treatment they suggest was HRT. Stop. Think again before you go down this route. HRT was once widely prescribed to all postmenopausal women to prevent chronic conditions. However, significant studies, such as the Women's Health Initiative, revealed increased risks of breast cancer and cardiovascular events, leading to a more cautious approach. Recent evidence suggests that the timing of HRT initiation is crucial. Starting HRT before age 60 or within 10 years of menopause can offer benefits, including reduced risks of coronary artery disease and improved quality of life while minimizing adverse effects. Annual physical exams for all patients. Every time you go to your doctor's clinic, they just seem to remind you of your annual physical exam. If that's the case, they haven't updated their knowledge really. The traditional approach of annual physical exams for all patients is being reconsidered in light of personalized medicine, which tailors healthcare based on individual risk factors and health status. This shift is supported by scientific evidence suggesting that a one-size-fits-all model may not be the most effective or efficient way to manage health. Personalized medicine, which considers a patient's genetic, environmental, and lifestyle factors, allows for more targeted and potentially more effective healthcare interventions. These shifts reflect a broader trend towards evidence-based medicine, where treatments and practices are continually reassessed in light of new research and understanding. And if you're still stuck in the same old routine where your doctor recommends things from the past, it's time to move on and become serious about your health.